So Lichen Planus. What is this Lichen Planus? This will be coming as a 4-mark question in our university examination, and it comes on dermatology in general medicine. So here I have taken points from Kumar and Clark textbook of medicine and Davidson textbook of medicine. Most of the points are from Davidson only. So let's see what is Lichen Planus. Lichen Planus is a chronic inflammatory skin disease. It is a chronic inflammatory skin disease that is affecting the skin and the mucous membranes. Chronic inflammatory skin disease that is affecting the skin and the mucous membranes. That is Lichen Planus. It is thought to be a cytotoxic T cell mediated autoimmune disease. It is thought to be a cytotoxic T cell mediated autoimmune disease. And what are the potential trigger factors? Hepatitis B virus, hepatitis C virus, etc. So what is Lichen Planus? It is a chronic inflammatory skin disease that is affecting the skin and the mucous membrane. Now let's see the pathogenesis, etiopathogenesis to be frank. The disease probably has an autoimmune basis that we have discussed in the previous slide. The disease probably has an autoimmune basis since there is an association with inflammatory bowel disease, primary biliary cirrhosis, autoimmune hepatitis, hepatitis B, hepatitis C, alopecia areata, myasthenia gravis, and thymoma. So this condition is associated with these diseases. So there is a probability of autoimmune basis for this Lichen Planus. So this thing you have to write under the heading pathogenesis or etiology. The next is clinical features. The Lichen Planus occur in both sexes and at any age, although it is usually seen between 30 and 60 years of age. It can come in both sexes at any age, but mostly it is seen around 30 to 60 years of age. It generally presents on the distal limb and most commonly on the flexure aspects of the wrist and the forearm, and also on the lower back. Flexure aspects on the wrist and our forearm, and also on the lower back. It is intensely itchy. It is intensely itchy and the lesions are violaceous, shiny, flat-topped. You can see the lesion picture here. I have shown here. So it is violaceous, shiny. So you can see it there. A flat top, polygonal papules with a characteristic fine lacy white network on the surface. So these are all the features that you have to write for clinical features. One more thing is there, post-inflammatory pigmentary change is also common. So it is particularly seen in the darker skin types. The mucous membrane involvement is occurring 30 to 70% of the patients who are having the Lichen Planus condition. So I guess it's clear. Once again, I will tell the clinical features. Lichen Planus can occur in both sexes at any age, but mostly it is seen in 30 to 60 years of age, and is generally present on the distal limb, more commonly on the flexure aspects of the wrist and forearm, and also on the lower back. It is intensely itchy and the lesions are violaceous. Shiny, flat-topped polygonal papules are seen with a characteristic fine lacy white network on the surface. Now let's see what are the differential diagnoses for this condition. The most common differential diagnosis, the most important differential diagnosis is drug-induced lichenoid reaction. But apart from that, there are some other differential diagnoses also include psoriasis, pityriasis rosae, pityriasis lichenoides, chronica, and secondary syphilis, etc., etc. Other skin conditions you can mention as the differential diagnosis here. So let's see what is the investigation. What are the investigations that we can do for this condition? The mainstay investigation or mainstay diagnosis is clinical features only. Classical clinical features you can notice in the patients. But the mainstay of the diagnosis, like the confirmatory diagnosis, is skin biopsy. And on skin biopsy, what all changes we can see? There will be characteristic histological changes that include hyperkeratosis, basal cell degeneration, and a heavy band-like T lymphocyte infiltrate in the papillary dermis with the affinity for the epidermis. And dermoepidermal junction has a sawtooth appearance. So, investigation part, the mainstay investigation, the mainstay diagnosis is through clinical features only, but skin biopsy we are doing. On skin biopsy, what are the characteristic histological changes? You have to mention these: hyperkeratosis, basal cell degeneration, heavy band-like T lymphocyte infiltrate, etc. And the other important one is the dermoepidermal junction. The dermoepidermal junction has a sawtooth appearance. That is important. The dermoepidermal junction has a sawtooth appearance. Coming to the management, the condition is usually self-limiting, although rarely it may persist for years, particularly oral Lichen Planus. So mostly the condition is self-limiting. Then let's see what are the treatment modalities that are available for this condition. The treatment is symptomatic and potent local glucocorticoids. It includes topical with occlusion or by injection for hypertrophic disease, or as an oral rinse for the oral involvement. So local glucocorticoids that may be helpful in intense itching. Short course of systemic glucocorticoids are sometimes required for extensive diseases. So symptomatic treatment we are giving for intense itching cases, we are giving the local glucocorticoids, and for the extensive severe diseases we are giving the systemic glucocorticoids also. And ultraviolet B, PUA or ultraviolet A1 can be beneficial, and for recalcitrant diseases, retinoids or immunosuppressants such as cyclosporine, methotrexate may be needed. So for the condition which is not resolving with the glucocorticoids, we can go for UVB, PUA, UVA1, and our immunosuppressants like cyclosporine, methotrexate we can use. And there is a small significant, a low but significant risk for malignant transformation is also there. So we have to advise the patient to smoke the cessation if he or she is smoking, and we have to do the active treatment, and we have to survey the patient. So these are the things that you have to write while Lichen Planus is asked, and it will be asked as a 4-marker. So 4-marker, these all points you have to mention in the university exam. So what is Lichen Planus? You have to mention what is it, how is it causing, what is the autoimmune basis for this condition, what are the clinical features. These are the clinical features. Characteristic findings are there: violaceous, shiny, flat top, polygonal papules with characteristic fine lacy white network on the surface. Then you have to mention the differential diagnosis, other psoriasis. The most important one is drug-induced lichen out reaction and psoriasis. And then investigation, clinically only we'll make the diagnosis, and skin biopsy will be do. On skin biopsy, the dermoepidermal junction has sawtooth appearance and hyperkeratosis, basal cell degeneration, etc. will be seen. Management, self-limiting, but we can give local glucocorticoids, and if in extensive conditions, we can give the systemic glucocorticoids also. And UVB, PUA1, UVA1 for the recalcitrant diseases, retinoids, immunosuppressant therapy also we can give for this condition. And but a low but significant risk for malignancy is there. So we have to surveil the patient, we have to do the active treatment, and we have to tell the patient to smoke, cessation of the smoking. So that's all you have to write for the Lichen Planus. Have a nice day. Thanks.